There are many things pet owners need to know about continually keeping their pets happy and safe. This season, there are many risks to face, such as preventing heartworms that may cause a bigger disease. That's why Dr. Janice Price from the Windmill Animal Hospital is back in studio to tell us more. Dr. Price, how are you doing today?
Doing great.
Allergies, is this what I'm hearing?
Oh yeah, it's a big time of year for allergies in people and in pets. You can hear it in my voice today.
Okay, hopefully you get better.
Oh yeah, I'll be much better.
Let's talk about heartworms, because that's really what you want to talk about.
Huge problem.
Huge problem here. Why is that?
Well, heartworms can affect any dog, whether they live inside or live outside, because heartworms are carried from dog to dog by mosquitoes. And there's no way to keep mosquitoes out of our house completely, and then when the dog goes outside to go potty, he can get bitten by a mosquito.
Has this problem always existed in the past? You said there's sort of a spike.
Well, when I first went through vet school back in the early 80s, heartworm was mainly associated with the Gulf Coast and the Mississippi Valley. But we're a very mobile society in America, and we've taken our heartworm-infested dogs with us everywhere, and now heartworms are everywhere. And there's been a big spike in the big country since Hurricane Katrina in 2005, because about 300 dogs from New Orleans were fostered out here, and most of them had heartworms.
And so how many of the dogs have you treated personally with?
We treat on average 1 to 2 dogs a week. Okay. We diagnose 1 to 2, maybe 3 dogs a week with heartworms. And it's something I really like to prevent rather than treat.
Is it, comparing to treating others, how easy or how harder is it to treat heartworm?
A heartworm treatment is hard on the dog. Okay. The medication slowly kills the heartworms. As the heartworms die, they break into pieces. They can plug up blood vessels in the lungs. The dog can feel pretty rotten and be pretty sick for a while. He has to be kept extremely quiet for at least 30 days after the treatment, and it costs a lot of money. It's not cheap. And it's very easy to prevent, and it's not expensive to prevent.
Now, when we say heartworms, it's not necessarily a
It's not what you see in your dog's poop. You will never see a heartworm in your dog because it's in the right side of the heart. So it's a hidden danger that you don't think about. But you can give once a month oral heartworm prevention. There's even a once every 6-month heartworm prevention injection. All of them are very, very thrifty in cost, and you can prevent this problem.
All right, with the pet owners out there, what are the symptoms really whenever, they should really get checked?
A lot of times the first thing owners will notice is the dog is losing weight. He just doesn't look healthy. He won't be as tolerant of exercise. He'll run around a little bit and then he wears out and wants to lay down. Eventually, and it depends on how much the dog reacts to the heartworms in his system as to how fast the symptoms develop. But the end result is the dog dying of congestive heart failure because the worms are in the right side of his heart and they're obstructing the natural flow of blood. Wow. It's a painful and miserable situation, and it needs to be prevented.
Well, like you said, it may be painful and miserable, but at the same time, the process in itself is really quick and easy.
Yeah, all you do is give a chewable tablet once a month and bring your pet to your veterinarian every 6 months for the injection, and you're done.
What does that tablet do exactly?
Well, this is where it gets a little complicated.
All right, let's go to scientific terms right now.
Well, if you think of all the mosquito bites a dog could get for the previous 30 days, and some of those are going to have a baby heartworm in them that will infect the dog, the once-a-month oral heartworm tablet will kill all those baby heartworms that were introduced over the previous 30 days. So it's treating for 30 days in reverse. It's a little bit of a different way of looking at things, but it works great.
A whole lot. Adult heartworm is 14 inches long.
Yes.
Up to 14 inches
long.
Up
to 14 inches long. It looks like angel hair pasta, and it has a rough covering like a nail file. So it causes a lot of scar tissue and clots and inflammation, and basically destroys your dog's cardiovascular system in his chest.
And I also know 4 to 6 months, that's when the worms appear on the right side of the heart.
Right. That's called the incubation period. When the mosquito bites the dog and gives the baby heartworm into the dog, then from that point in time, it takes at least 4 months for that heartworm to go through all its life changes and then arrive in the heart and get up to 14 inches long.
And that's when you'll actually see the symptoms to the dog. So within the 4 to 6 months.
After the 4 to 6 months.
Oh my gosh.
Yeah, I know. This is a very frustrating thing. It's a hard concept to grasp, but just get your puppies started on heartworm prevention, get your adult dogs tested, get them on heartworm prevention, and it'll be fine.
All right. Thank you so much, Dr. Price.
It's my pleasure.
Get it done, or else she doesn't have to stress over that. To get your pet great care, you can visit Windmill Animal Hospital. They're off Windmill Circle. The number to set up an appointment is on your screen. They're even open on Saturdays. Also, their info is on their Facebook page as well. Go to our website, KTAB-4U.com, and search Windmill Animal for other segments.